What's up guys, Dr. Jeremy Landry with Kansas City Laser-Like Lipo. I'm going to talk about metabolic syndrome today, and odds are a lot of you watching this know what it is because you've seen TV commercials talking about it. Maybe your doctor has even mentioned to you that you have some of the signs and symptoms of pre-metabolic syndrome, or you've been diagnosed with metabolic syndrome. But unfortunately, a lot of people have no idea what it is, but they have it and they don't realize it. And statistically, greater than 35% of Americans have metabolic syndrome, greater than 50% of Americans that are over the age of 60. And that's why I want to talk about this today. And in our weight loss practice, obviously, obesity is a major factor. It's actually the greatest risk factor for developing metabolic syndrome. So a vast majority of our patients in our practice do have metabolic syndrome. So let's talk about this. Now, metabolic syndrome is a combination of different health factors. There's really 5 different things that doctors look at. I'm going to run through those. And really quick, before I do that, I also want to say that if you have metabolic syndrome, you have you're 5 times more likely to develop type 2 diabetes than somebody who doesn't have metabolic syndrome. And you're also twice as likely to suffer from a stroke or a heart attack, okay? So 5 things that doctors look for. Number 1, elevated blood pressure. And if your blood pressure is consistently greater than 130/85, it's a risk factor. Now, obviously, blood pressure can go higher and higher than that. There is, pre-hypertension, hypertension, stage 2 hypertension, and the list goes on. But there's a proper way to diagnose high blood pressure. So if you go to your doctor, they take your blood pressure once and they tell you, oh, you have high blood pressure. They didn't do it correctly. You have to get 3 separate measurements. You could do those 3 separate measurements on the same visit. A lot of times when you show up to your doctor, you get what's called white coat syndrome. You're a little nervous. You don't want to be there anyways. Your blood pressure's up. And so you might have high blood pressure the first time they measure it. Well, maybe 10 minutes later, they check your blood pressure again and it's come down. It's 120/80 or 125/85. And then they check it a third time, maybe before you leave. And let's say your blood pressure is even lower. So that just screams out white coat syndrome. You were nervous. That's why it was elevated. However, if they check your blood pressure 3 separate times or maybe 3 separate visits and it's always elevated, then they can diagnose you with high blood pressure. Number 2, if your blood sugar is elevated, meaning greater than 100 milligrams per deciliter after 8 hours of fasting. So if you've ever gone in and had a cholesterol test or a lipid panel and they said you have high blood sugar, it just means that it was greater than 100 milligrams per deciliter over the course of 8 hours, or if it's greater than 140 over the course of 2 hours of fasting, you have high blood sugar, and there's a host of issues that can go along with that. You can Google high blood sugar and complications and read all about it. Number 3, if your triglycerides are elevated. Now, the funny thing is, most people have no idea what triglycerides are, but they know what fat is, okay? Because we think about our belly. It's like, I hate this belly fat. I want to get rid of it. I hate the bat wings on my arms. And people think of fat as being globs of fat, but it's really clusters of fat cells. You have about 30 billion fat cells, and your fat cells have triglycerides. So triglycerides are fat, and that's just what fills up our balloons, which are fat cells. And triglycerides is water, glycerol, and free fatty acids. So if you do a lipid test, cholesterol test, and your triglycerides are greater than 150 milligrams per deciliter, you have too much fat going on in your body. Number 4, if your HDL, which is your good cholesterol, if that is low, but your LDL, your bad cholesterol, is elevated, huge major risk factor. And unfortunately, that's a lot of Americans that are walking around. You want to see the HDL be very, very high and LDL be very, very low. And total cholesterol, yes, doctors want it to be less than 200. However, I'm one of those. If your HDL is really high, your LDL is very low, and your total cholesterol is maybe 220, 230, maybe even 240. Personally, I'm okay with that. Your body needs fat. Every cell in your body has fat and is what it's made out of. And then number 5, which is the most important risk factor, is how much belly fat do you have, or visceral fat. Visceral means organ in Latin. And so to really kind of determine this, you can get those body composition scales where you stand on them and it sends an electrical impulse throughout the body. You don't feel anything, but it tells you how much muscle mass you have, how much body fat you have, how many pounds of fat you have, what your visceral fat score is. That's an easy way of doing it. But if you want to do another quick and easy way, you can take your waist circumference in inches. So find the belly button, measure around it, and let's just say that number is 40 inches, okay? Multiply that number by 2, which means 80 inches, and then take your height in inches, and I'm 6 foot tall, so we'll just say 72 inches. So if that number around your waist times 2 is greater than your height in inches, that means you're over fat. And this was a technique that was developed by Dr. Mark Hyman with the Cleveland Clinic. He's actually the director of functional medicine at the Cleveland Clinic. He's been on Dr. Oz, but it's a really quick way of determining if you have too much belly fat. And what happens with excess belly fat is that it's growing back behind the muscle wall, which means it's squeezing on the liver, which works its way into the liver and can cause non-alcoholic fatty liver disease or cirrhosis, or elevated blood pressure, or both. And so as fat squeezes on the kidneys, your blood pressure starts to elevate and go up. Now, like I mentioned earlier, obesity is the greatest risk factor for metabolic syndrome. However, there are other risk factors such as heart disease. If you have diabetes, that's a huge risk factor. Along with diabetes, you typically have poor blood flow circulation to the extremities, which causes neuropathy or diabetic neuropathy, numbness, tingling, burning sensations. You can have peripheral arterial disease or PAD. Plaquing within the cardiovascular system. There's a lot of complications. However, most of those risk factors go right back to being overweight or having obesity. And greater than 71% of adults in the United States are overweight, which is 7 out of 10 people, greater than 35% of kids. And then with the obesity rates, it's greater than 39% of adults. So we do have a huge health crisis when it comes to being overweight. Now, the medical community will say, once you have metabolic syndrome, they're going to say it's something that you're just going to have the rest of your life, but it can be managed with high blood pressure medication, cholesterol medications. But let me tell you, if you get yourself healthy, if you really work on changing your lifestyle, and it's mainly just what you're eating, if you can eliminate all the excess sugar or the added sugar, get rid of the processed carbohydrates. So basically get rid of the white rice, the white pasta, the white bread, the white potatoes. I know those are good sometimes, but there's no fiber associated with it. And they basically convert to sugar right away. That goes into triglycerides and gets shoved into your fat cells, and you gain more weight. And you have all these other health factors that go with that. Now, if you can replace all the white stuff with the brown stuff, brown rice, whole wheat pasta, quinoa, sweet potatoes, 100% whole wheat bread, you're getting a huge dose of fiber. It slows down that conversion to sugar and doesn't cause you to gain a bunch of weight. So you can have some carbohydrates, go for the good carbs. At the same time, don't go crazy with the good carbs. And when it comes to your other food choices, lean protein, chicken, different types of fish if you like fish, lots of veggies. You really just can't go wrong with vegetables. You can eat them raw, cook them, steam them. It's really up to you. And good fats, things like avocados, nut seeds oil, extra virgin olive oil, coconut oil, MCT oil, real butter, things like Kerrygold butter, organic eggs. All that stuff is really good for you. And I know for years and years, the American Heart Association said eggs are going to kill you. Stay away from them. They completely reversed their position on that. And, eggs are good for you. And we've known that the whole time. And with the same token, don't go crazy with the good fats, but you can definitely have some good fats. And just making those simple dietary changes right there is going to make a huge difference in your overall health and wellness. You're going to lose weight. You're going to see hormones start to balance out. And the good news is a lot of people who have the metabolic syndrome, they may see it go away. If you guys have any questions whatsoever, call the number on the screen. Feel free to shoot us an email, leave a comment down below. Now, I do want to state, I'm not your personal doctor. If you have questions, concerns, if you think you maybe have metabolic syndrome or anything else, make sure you visit with your primary care physician. I'm not trying to diagnose anybody with this YouTube video, but if you have any questions, we're more than happy to help you out. So call the number on the screen, shoot us an email, leave a comment down below, and be sure to subscribe to our YouTube channel. We do a great job, in my opinion. I'm a little biased, but I feel like we do a great job coming up with videos talking about important, relevant topics, coming up with some great content. But check out the different videos on the channel. And again, any questions, reach out to us. We're always here to help. And I'm going to put a link in the description down below talking about our #1 weight loss program that we do with our YouTube audience and with our patients here in Kansas City and in Kansas and Missouri that help people get past the metabolic syndrome and at the same time drop a lot of weight. So I'll put that link in the description down below. So until next time, thank you for watching this video. We'll talk to you soon.